It's time for the Slocum Dixon Medical Moment. Adrian in studio. Good morning.
Good morning.
So, number one, I know you guys are going to be really involved coming up this weekend with the Heart Run and the Expo and all. Like, there's good. Like, this is a big weekend.
Yeah. It's something we've been kind of preparing for a month or so now. So we'll be at the Heart Expo all day on Friday. We're doing a bunch of different kind of screenings and activities. So everything from bone density screenings to some physical fitness stuff. So we're going to do like push-up tests and the old style like V-sit and reach that used to do in high school. You know, that kind of stuff.
I was awful at that.
Yeah, I was too.
Yeah, the presidential fitness thing. Yeah, the president would have shaken his head at me. He'd be like, no. But the cool thing is, with the amount of people that participate in America's Greatest Heart Run and Walk, it gives Slocum Dixon a chance to kind of, show everyone what you guys have to offer and give them, especially children, a chance to see that stuff as well.
Right. Yeah. So it's a good opportunity for people to come over and do something fun and kind of interactive at first, and then we'll have all the information there about our group and all of our doctors, and I'll be there for most of the day, and we'll have a lot of other people that are there that can answer questions if you have a question about a certain doctor that you want to see or something like that. So we're there to help. So stop by. We'll be in the healthy, I think it's going to be called the Healthy Living area. The Expo set up a little different this year. So.
Awesome. Very cool. And if you want more details, you can add Slocum Dixon on Facebook. Just like the page, and you'll be able to help and get all the details on that as well. So would you like to introduce who you brought with you today?
Yeah, so March is actually Colorectal Cancer Awareness Month. So we brought our gastroenterologist, Dr. Mirza, with us today to kind of talk to us about getting our cancer screenings and to stay healthy.
Dr. Mirza, good morning. How are you?
Hi, good morning.
Number one, I'm going to butcher the gastro into. So can I just call you the GI doc? Is that
sure?
Because that's what most people call it at this point.
Right,
most people that's the common thing.
Right.
It's always like the awkward situation, and it's always an awkward conversation when it comes up to the stuff that you have to deal with. It just is what it is, because it has to deal with the stomach and the insides, and a lot of times it has to deal with the number two and stuff.
Right.
That like it all. How else do you talk about it?
Yeah.
But it is a serious thing, especially colorectal cancer. Anything with the word cancer involved in it is very, very serious. So what should we look for? How do you, I don't want to say how do you prevent, but what should you look for? That kind of stuff.
Well, March is Colorectal Cancer Awareness Month, and it strikes 1 in 5 people in their lifetime to develop colorectal cancer.
Oh, wow.
So the risk goes exponentially higher after age 50. So everybody who has no risk factors like no family history, no rectal bleeding, no diarrhea, or any other risk factors should get a screening colonoscopy starting at age 50.
Now, I've been told that like once you hit like a certain age, you should go for colonoscopies on the regular. Is that true? That's part of your workup and whatnot.
Right. If you're 50 years old, you should get a colonoscopy.
Okay, I have some time. I'm good.
Yeah,
I'm good. Seriously, like other guys my age have already had theirs. And I'm scared to death. I really am. And maybe this is because I've never gone, like a guy, a bunch of my friends have gone through it and have had no problems or whatever, but something about it just like it, I don't know. It's a very common thing to have done. It's very safe.
That's correct. Yes. The worst part of the test is night before, when you have to take the prep to clean your bowel so we can have a good look.
Right.
And the best part of this test, you will snore through the colonoscopy. It takes about 15-20 minutes to do a colonoscopy, and we give sedation. Generally, we use propofol, which is you are deeply sedated.
Oh, nice.
And most of the time, people say, well, when are you going to do the colonoscopy? And we say, well, gee, we already done that.
Okay,
so, good. They say, gee, it was so easy. I should have done last year, or it should have done 5 years ago.
Sure. We're talking about like colorectal cancer awareness month and whatnot. What should people look for? Like, what are warning signs? Because a lot of people may not, as far as on the radar, and that's why we brought it up today, because it's awareness month and whatnot. What should people look for? What are warning signs?
Well, generally, people who have certain abdominal problems like diarrhea, abdominal pain, rectal bleeding, anemia, or any bowel irregularities which are chronic, they go to gastroenterologist for colonoscopy. So if you are under the age of 50, if you have any of those, you should approach first your primary care physician and then gastroenterologist. If primary care physician feels it's important to send you to a gastroenterologist.
And one of the nice things about Slocum Dixon, and I'm a Slocum guy, and I'm not, I absolutely love Slocum Dixon. I have been since I was a child. But being able to have my primary in one spot and talk to my primary about whatever's going on, and being able to walk down the hall and get labs done, and if there's a referral, 9 times out of 10, the person that needs to be referred to is in house or right down the hall, and they can just make the phone call. This one secretary to another. Hey, can you get this person in? Da, 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 and it saves a lot of time, and time is money, and
exactly,
it's very convenient as far as that goes. It just makes life so much easier.
Right. Yeah, and that's one of the great things to me, even when you're talking about if you have a cancer. Positive cancer test, we kind of walk you all the way through it, from primary care, who's going to advise you to get the screenings, to the specialist who would do the screening, and then we have a whole oncology department as well, where we just really redid the oncology suite a few years ago, and it's all brand new, up to date, with chemotherapy area right there, and so we really take care of you all the way through, and like you said, lab and radiology located closely to everything as well.
Absolutely. So. It is the Slocum Dixon Medical Moment, Slocum Dixon Medical Group on Burstone Road. Of course, SDMG, Slocum Dixon Medical Group, SDMG.com, and of course, like them on Facebook as well. Dr. Mirza, obviously, we're talking about colorectal cancer. What are the majority of things that you have? Like, what are the cases that you normally see? What's the biggest thing that you see on a regular basis that people may not be aware of that you can help them with?
Well, statistically, 70% of all your patients which you go to primary care physicians have some kind of GI problems.
Okay.
And the most common are acid reflux.
Okay.
Abdominal pain, bloating, diarrhea, there are a bunch of other conditions, but acid reflux, which is called GERD, which is very common.
And that's some serious stuff. Like, if you have really bad acid reflux, it could feel like a heart attack. That's how bad it can be,
correct.
Right?
That's one of the symptoms of acid reflux is atypical chest pain. Whenever you have a chest pain, you want to make sure there is no cardiac issues. Right. And after the cardiac issues are ruled out, then you check for acid reflux, check for conditions called Barrett's esophagus, which is a pre-cancerous condition. So people who have a chronic acid reflux at least twice a week, they should contact their primary care physician or their gastroenterologist for a screening upper endoscopy also.
Absolutely. If you're looking for a new primary care physician is what I'm actually trying to say, Slocum Dixon, absolutely incredible. Again, SDMG.com. You can see Adrian and the fine people at Slocum at the Expo for Heart Run coming up on Friday and on Saturday. Adrian, thank you so much. Dr. Mirza, it was great meeting you. Thank you so much.
Likewise.
It is the Slocum Dixon Medical Moment with Big Papa and Bandit in the morning here on KISS FM.